Welcome again to Clear Path Wellness with Joshua, the patient advocate. Today we are going to discuss the management of arthritis and the complications of arthritis that our patients experience in the context of Kenya's healthcare system. So in this video, the elements which we are going to tackle include: 1, the treatments that are available for patients with arthritis; 2, the surgeries that patients with arthritis can expect; then 3, the nursing care for patients with arthritis, both at home and in the healthcare facilities; then 5, the right diet recommended for patients with arthritis; then 6, complications that patients with arthritis do experience. So to start with the first objective, what treatments are available for arthritis? So the primary goal of treatment of arthritis is usually to control pain and reduce joint damage. So you find that there are common pain medications which include, for example, meloxicam and piroxicam. So piroxicam can sometimes cause stomach ulcers, gastric ulcers that is. So meloxicam on that basis is usually a preferred painkiller. So we commonly prescribe the analgesics for pain relief, while the non-steroidal anti-inflammatory drugs are usually prescribed to reduce both pain and inflammation. So on that basis, the most common analgesics are diclofenac and brufen. So you find that for diclofenac, we can give diclofenac injection. So that is usually very necessary in cases of moderate to severe pains. So for every severe arthritic pains, opioid analgesics are usually an alternative to alleviate the pain. And examples of opioid analgesics to start with basically include tramadol, and also we have morphine. All these drugs are available in form of oral and injectables. For rheumatoid arthritis, the drugs are called DMARDs. Why are they called DMARDs? It is because for rheumatoid arthritis, since it is an autoimmune disease, these drugs are used to regulate the immune destructive tendency on the joint. So these drugs mostly are available on prescription basis, and in some cases you can get them in licensed pharmacies. So objective number 2, what surgeries will an arthritis patient expect? So in case erosion of the joint becomes very severe and medication is not helping, surgical intervention might be needed to smoothen the spikes that result from erosion of the joint to reduce pain during locomotion. So in these cases of severe damage, also joint replacement can be a surgical alternative, whereby we replace the joint with an artificial prosthesis that is usually resistant to wear and tear. So another form of surgery is joint fusion. For example, with regard to the spines, maybe you had ankylosing spondylitis. So it can be surgically determined that you'll be done joint fusion so that the spine in that regard can be stabilized. So the third objective, nursing care for patients with arthritis. So nursing care usually focus on relief of pain with medications, and also sometimes without medication, that is non-pharmacological pain management. So we also assist patients to balance rest and activity, also assist patients with exercises to help them build muscles of the joint, which provide better support of the joint. That is very important. But patients are also advised to avoid severe exercises, extreme exercises, more so when they feel pain with exercises. Also, they need to take their painkillers every morning before they engage in exercises to make sure that these exercises do not exacerbate the pain. So In regard to measured exercises, the patient can take like 6,000 steps with jogging or running. Okay, yeah, actually. Also, whenever they experience arthritic pains, they should assume a comfortable position, maybe sitting position, to avoid exacerbation of pain due to a strenuous sitting posture. So as nurses, we also monitor for medication side effects and educate the patient on these side effects, more so the side effects of opioids and even non-steroidal anti-inflammatory medications. So also we help the patient use assistive walking devices, the walkers, in case the patient has really debilitating arthritic condition. So in that regard, that is very important. And for rheumatoid arthritis, as nurses, we ought to always follow up on the laboratory investigations, that is blood sample analysis for the rheumatoid factor, to determine the degree at which the autoimmune effect is still happening. So as clients await their laboratory results, they should be given counseling. That is for rheumatoid arthritis, very important. This is a very debilitating condition. Also, you ought to always examine them to identify rheumatoid nodules, which can indicate that active autoimmune destruction is happening. Okay. Then another common form of arthritis is arthritic gout. This occurs as a result of uric acid levels in blood getting high due to inability of the kidneys to excrete uric acid. And the medication for arthritic gout is allopurinol, which clears the uric acid out of blood. So you find that this uric acid is what damages the joint tissues. The acid burns the joint tissues, and on that basis actually occasions arthritis. Other medications for arthritis, more so for regeneration of the tissues, include glucosamine and chondroitin. These are hormonal medications which really help to regenerate the damaged joint tendons and cartilages. So the next objective, the right diet for patients with arthritis. Important to mention before, arthritis patients should really focus on diet that significantly reduces their weight or prevents them from gaining excess body weight. So on that basis, that is the first criteria to the diet. Then the second criteria is they need anti-inflammatory foods like tomatoes, olive oils, fruits, vegetables, and also ensure that they take adequate amount of water per day, preferably 3 glasses, 3 liters or 8 glasses per day. So also inflammation inducing foods like sodas, fried meats, processed carbohydrates should be avoided. So proper nutritional support is very important for these patients, since in case we don't manage their diet well, that can give arthritis a chance to spread throughout the body. So focus nutrition. So also diet forms an important hallmark to prevention of arthritis, more so to clients in the middle ages. So when you are in the middle ages, you are yet to experience arthritis, you ought to work on your diet early. Avoid obesity early. So in severe cases of arthritis, arthritis can lead to complications of physical disability. For instance, somebody will be even unable to carry out their daily chores. Basic activities like cooking or hygiene become a challenge. So you find that in the weight-bearing joints like the hips and the knee joints, the condition can prevent the patient from walking comfortably, standing or sitting upright. So in that regard, you ought to prescribe the right nursing management to the patient to assist them with their activities of daily living. So chronic inflammation also associated with certain types of arthritis can affect other organs like the kidneys and the skin if left unmanaged. That is very important, more so for the case of rheumatoid arthritis, very important. So in review, The treatment of arthritis generally focuses on symptoms reducing and improving joint function through a combination of drugs, physical activity, and in advanced cases, surgery can be done to repair the joint or to replace the joint. So in context, that is the review for the management of arthritis and what to expect in relation to complications of arthritis that our patients do incur in the context of Kenya's healthcare system. So in case you have a question, drop it there in the comments. That is all I had for you today, and see you next time.